In this last video, we will discuss vicarious trauma and the importance of self-care when supporting students through a trauma-informed lens. Trauma is widespread not only among university students, but also in the general population. In Hong Kong, 3 out of 5 adults have experienced at least one serious and potentially traumatic event during childhood. Trauma can be experienced individually and collectively, and the pervasiveness of trauma demands a holistic approach to support healing and thriving. In the university setting, staff well-being is intrinsic to students' well-being. Further, educators, administrators, and support staff all play a crucial role in modeling positive, resilient, and healthy behaviors for our students. Therefore, it is important to create a culture of self-care that encourages all staff to prioritize their own well-being. Working directly with students with a history of trauma can put you at risk of being impacted by trauma. This is called vicarious trauma, a type of secondary trauma that occurs when individuals are exposed to the traumatic experiences of others. Even if the traumatic experiences did not happen to you, repeatedly hearing stories about them can affect your thoughts and feelings. Some signs of vicarious trauma include feeling fearful or avoiding certain things that remind you of the situation, mood swings and irritability, detachment and withdrawing from social connections or activities, having disturbing and upsetting images in your mind, and sleep disturbances. These are normal reactions and do not in any way indicate weakness. As humans, we are social beings who naturally empathize with others to deepen connections, and we often feel their pain when trying to understand others' negative experiences. However, supporting others experiencing distress can sometimes take a toll on your own health. The physical, emotional, and psychological cost of helping others is called compassion fatigue, which is a common occupational hazard for those working in higher education. It is similar to experiencing burnout, which refers to a more general sense of dissatisfaction and exhaustion. When supporting students, particularly those experiencing distress, it is important to also take care of yourself. This broadly includes taking active steps in managing and improving your physical, emotional, and mental health. Physical health is maintained through regular exercise, a balanced and nutritious diet, as well as adequate rest. While working in a fast-paced and busy environment, such as our university, we have to remind ourselves to take breaks and create some physical distance away from the workspace. This may include taking a walk, going out for lunch, joining a staff exercise program, or setting reminders to go to the pantry for some water on a busy day. Being physically active and healthy ultimately improves our mood and work performance. Another dimension of wellness is emotional health, which involves having an awareness of your emotions, being able to manage and express those feelings in a healthy manner, and building positive relationships. Checking in with your feelings regularly, identifying sources of stress, and developing healthy coping mechanisms, such as deep breathing and other relaxation techniques, can help manage negative or difficult emotions. Establishing healthy boundaries and practicing effective communication can also improve relationships and reduce conflict. Mental health involves the overall functioning of the brain, such as the way we receive and process information, form memories, and make decisions. Taking care of our mental health starts with being kind to ourselves and practicing self-compassion, especially in moments of difficulty or failure. One way to practice self-compassion is to challenge negative self-talk. When you notice negative thoughts, try to reframe them in a more positive light. Ask yourself, is this how you would speak to a dear friend? Celebrate your successes, no matter how small they may seem. Another way is to engage in activities that bring you joy and a sense of accomplishment, such as hobbies or volunteering. Developing healthy lifestyle habits and implementing self-care strategies can help ease the negative effects of vicarious trauma, compassion fatigue, and burnout. Self-care can look different for everyone. Therefore, it is important to experiment with different strategies and activities, and identify those that work for you. Mindfulness practices, such as yoga and meditation, can help reduce stress and improve overall well-being. There are a variety of mindfulness practices, which involve breathing exercises or guided imagery to relax the body and mind. Being more aware of your thoughts and feelings without judgment and living in the moment can help you respond to difficult situations with more clarity and develop a greater sense of compassion and empathy towards yourself and others. Engaging in regular reflection to understand yourself and the ways you respond to stress are also effective strategies that promote self-discovery and prepare us to better handle future challenges. This could be as simple as reflecting on 3 things that went well today or that you're grateful for. Lastly, reinforcing positive social connections is a great way to relieve stress. Spending quality time with friends and family improves our emotional and mental well-being, and helps us maintain perspective without getting lost in negative thoughts and feelings. In order to effectively support students and those around you, it is vital that you first take care of yourself. Taking care of yourself can help you feel more positive and confident, and places you in a better position to help others. However, there may be times when the stress feels too heavy or the self-care strategies that worked before are no longer working. In those moments, reaching out for additional support is the most effective act of self-care. In fact, seeking support demonstrates insight, strength, and resourcefulness. By reaching out to a trusted resource, such as a counseling service or peer support group, you are proactively taking care of your own well-being and creating opportunities to strengthen connections with others. As university educators, administrators, and support staff, we all have a shared responsibility in caring for our students' social, emotional, and academic well-being. At the same time, we must also prioritize caring for each other and ourselves.